Hello, welcome to VMC. I'm Dr. M. Today we are going to cover what you need to know to keep your pets as safe as possible considering the current SARS-CoV-2 virus that is circulating around. So join me, you'll learn something today. First, let's address some background information that's important for you to understand before we move on to discussing what issues we're noticing in our pets and how you can best prevent them from getting sick. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. It's colloquially called COVID-19 because this novel coronavirus was first identified in 2019 in Wuhan. SARS-CoV-2 is a novel coronavirus, meaning that prior to this, it had not been identified in humans. This virus primarily spreads through the air. So when a person who is infected talks, sneezes, coughs, sings, breathes, they are exhaling virus particles into the air, and then another person will breathe those particles in and the virus will go on to infect them. Unfortunately, SARS-CoV-2 is incredibly infectious and will spread rapidly and easily between people. Even if the infected person has left the room, the virus can still be in the air and will continue to infect other people that walk into the room later. It is classified as biosafety level 3. This is the same classification that's used for things like tuberculosis because it is such a serious virus, can cause so much harm, and is so transmissible between people. We also need to remember that SARS-CoV-2 is an RNA virus. That means it is a single strand, not like DNA, which is a double-stranded piece of nucleic acid. Because COVID is an RNA, this means that it is much easier for it to experience mutations, and therefore it will mutate more often and faster than a DNA strand would usually mutate. This is important for us to remember and recognize because it means that the more spread of this virus from human to human, the more mutations we are going to see. And with those mutations, that will mean that this virus will then spread back through the people that it had already previously infected. And it also means that things like vaccines and our immune system's history of exposure to this virus will quickly become out of date and less effective against the newer, more current strains that are circulating in the population. In 2020, as far as the veterinary world goes, I first started hearing about non-human species at zoos being infected by the staff and or the visitors at those zoos, and most commonly it was the non-human primates and the large cats that I was hearing about, and they would become infected, start having symptoms, and some of them died. Since then, we have a little bit more research into the other species, and we now have proof that cats and dogs and mink can also be infected. It is important to note that up until this point, these animals are getting sick from people. So the animals are not infecting the people, it's the other way around. It also doesn't seem like there is a lot of spread from one non-human animal to another at this point. However, that could change. And at this point, laboratory investigations have shown that cats are most susceptible to SARS-CoV-2. And so as far as household pets go, we are most concerned for our feline friends, but we need to note that dogs can also be infected. It's just a bit less likely. Observed symptoms of COVID-19 in our household pets can be a little bit different from what we expect to see in people, and our pets are more likely to have asymptomatic infections. There were some research studies where dogs were being sampled, and even dogs that had had zero symptoms still ended up testing positive for having had COVID. If there is COVID in your household, just because your pets don't have symptoms doesn't mean they haven't contracted this virus. virus. There was another study in cats that showed about roughly 50% of the infected population of cats had symptoms. And of the symptoms that are most commonly reported, we do hear about respiratory symptoms, coughing, sneezing, and nasal discharge being some of the most common. However, it's also possible to see GI symptoms. Think about vomiting and diarrhea, GI upset sort of symptoms. I also want to note here that this can be a bit tough because a lot of the symptoms that humans report, like tinnitus or memory issues, word finding problems, cognitive dysfunction, mood changes, loss of taste, loss of smell, and so on, would be very hard for us to pick up on in our pets. And we would struggle to be able to accurately diagnose a lot of those things. What you might see, say if a cat or dog is losing their sense of taste or smell, you might see that they start to eat less or become picky with their food. This is because especially cats really rely on how the food smells in order to entice their appetite and make them want to eat it. And there absolutely have been cases where infected pets have had severe enough symptoms that they were euthanized. And in some of those animals, postmortems have been performed and the COVID virus was isolated from their lung tissue, showing that yes, this is what is infecting, harming, and ended up being the cause for their death. Now here's where we start to have less research in the veterinary world specifically, because this virus is still quite new to the world. We're only a few years into this pandemic here, and so there's still a lot that we have to learn. And of course, the bulk of the research has been focused on the human species, as it should be, as humans are so susceptible to infection and reinfection with this virus. So what we are going to do at this point is use the information we know for the human species and apply it where we can to veterinary species. Now, human medicine is of course outside of my specific area of expertise. I did consult some colleagues who are professionals in human medicine, and I also worked with a professional medical researcher in order to compile this information for you. At this point, we do not have any means of treatment, cure, or vaccination for our pets when it comes to COVID-19. And when it comes to people, we have vaccines that do reduce the risk of severe initial illness and death, and they do somewhat decrease the risks of long-term health issues, but by no means are they perfect at that. And as time passes, our vaccines seem to be a little bit less effective because, as we talked about earlier, this virus continues to mutate. Because of all of this information, truly the best thing that we can do to protect our pets is to protect ourselves from contracting COVID and then bringing it home to our pets. We also have a good amount of research now showing all of the horrendously serious long-term health risks that come with being infected and reinfected with SARS-CoV-2. I would suspect that our animals are also going to be susceptible to similar long-term health issues, but we do not have any research in other species at this time. Okay, so after I had filmed everything else, a study came out in dogs, and this information is important enough that it needs to be included into this video, so I thought I would film this little intermission here. In the research study, a bunch of beagles were infected with COVID, and they were infected in two different ways. Some of them were given the virus through their upper respiratory tract. Other dogs were housed with the dogs who were infected. This showed that it is possible for COVID to transmit both from the air into a dog, but also from one dog who is infected to another dog that they live with. And this is important information that we didn't have before. The second major finding is that even in the dogs that were asymptomatic, this particular study was looking at what sort of brain damage this virus is doing, because we have so much research showing how COVID is damaging people's brains even if those people have an asymptomatic infection. Unfortunately, it's the same in our dogs, and we didn't know this before. Like I explained near the beginning of this video, there's a lot of symptoms that humans have that it would be very hard to try to assess in our dogs, and so looking at their actual brain tissue like this study did is really the only way we have to check. The study found substantial brain pathology, and a lot of that was within the blood-brain barrier, meaning small vessels were being damaged. Now, this finding aligns with other research studies that show COVID is damaging small blood vessels all over humans' bodies. Furthermore, the researchers found a marker that is linked with neurodegenerative diseases, meaning that this virus can cause brain degeneration for our dogs as well. Makes it even more important that we are very careful to prevent infecting our dogs with COVID. So to prevent infections from coming into our households, a multi-layered approach is standard of care. This means 1, make sure to keep up with your COVID vaccines and boosters. The boosters appear to be lasting about 6 months as far as efficacy goes, and over time the vaccines are being updated in order to hopefully make them more effective to the mutations that the coronavirus has gone through as it's been repeatedly circulating through the human population. Second, we absolutely must be using well-fitting masks that are of the best quality possible. This means using N95s or KN95s wherever possible, as those are shown to be much more effective at preventing spread from yourself if you are currently infected but don't yet know it, or from others infecting you in that same sort of scenario. When a mask is fit tested, that does provide the best protection. However, even a non-fit tested N95 is going to offer way more protection than a surgical mask would or a fabric mask would. Third, we need to be considering air exchange in all of the spaces we go into. It's recommended to be achieving at least 6 complete air exchanges per hour. This is because we know that the virus does hang in the air after a person has breathed in that space. Now, a lot of people will measure these CO2 levels inside of a room in order to help assess how much air exchange is actually occurring in that space. Here's where things get a little more challenging, because it does seem like there are slightly different parameters depending on which country you are in as to what's considered acceptable. Everybody seems to agree that you must stay under around 950 to 1,000 parts per million. We know that if you go over that amount of CO2 in a room, it leads to headaches and brain fog and fatigue, increases risks of errors occurring, etc., etc. And so these risks are well known. What we don't know is what level is best for reducing the risks of spreading viruses like COVID. I've been reading some people saying to keep indoor spaces in the 700s, but I was unable to find any research to back that up. What we do know is that outdoor air is usually around 425 to 450. So the closer that the room air is to outside air, the lower the risk of spreading COVID is. So at this point, it would be reasonable to try to keep your home's CO2 levels as low as you can, perhaps aiming for around the 700 mark, but absolutely be certain to keep below that 1,000 cutoff point at all times. There are a number of different CO2 monitors that can be used for this. One of the most popular at this point is called the Aranet, and I did end up purchasing one of those, and I set it in various parts of our home to see how our air exchange was, and I was shocked to find out that actually our bedroom overnight did not get near enough air exchange. So you should be checking your home as well, if at all possible to do so. If it's not possible to do so, just keep in mind that cracking a window or cracking a door can make a significant difference. Hand in hand with monitoring CO2 levels, we also need to be using HEPA filtration. HEPA filters will remove particles as small as viruses. As a bonus, they also help to remove smoke from the air, which if you live somewhere that gets a lot of fires in the summer, this can be very beneficial to you. If you have asthma, if you have environmental nasal allergies. HEPA filtration will also help to reduce all of those things in the air and be incredibly helpful for you. Sorry, my dog came running in. She's very excited. All right, let's try keep going now. Now, there are a number of different ways you can go about doing this. As far as commercial, currently the Levo HEPA filter is a very popular commercial option that a lot of people are using. However, commercial options are more expensive than making your own HEPA filtration at home. There is a whole bunch of research by some wonderful PhDs who have invented this thing called a Corsi-Rosenthal box. There are a number of different variations for these boxes. Essentially, the basic initial version that came out was using HEPA filters in a cube, putting a fan on top, and then having the air suck through the filters to filter the air and then blow up the top in order to help with room air circulation and removing any virus that could be in the air. Because the research shows us that 40 to 60% of the transmission of COVID between humans occurs when the people are pre-symptomatic or asymptomatic. This means that even if you do not have symptoms, you could still be spreading COVID, and the same goes for any person that you encounter. So be very careful about who you have over to your home. If they are not wearing a well-fitted mask whenever they are in public or at work, then I would have them wear a mask in your home. This also means that as people, we should be avoiding situations where these mitigations aren't possible to be implemented. So if you are somewhere that has a high CO2 level, or if there is no HEPA filtration going, or if most of people are not wearing appropriate well-fitted masks, or if the duration of exposure is going to be long, all of those things raise the risk factor and increase the likelihood of you contracting this virus and then bringing it home to your pets. Another thing that research has shown us is that the rapid tests are not as good at picking up the current strains of COVID that are circulating around, again, due to how quickly COVID can mutate. As a result, the current standard is to swab the back throat, the inside of both cheeks, and both nostrils, not only your nostrils, when you are going to use a rapid test. It's also crucial that people are using a rapid test every single day that they have symptoms. You cannot just test once at the beginning of symptoms and take that test result as solid proof of anything. Because these tests aren't as good at picking up on the current strains, we are often seeing that people will not test positive until day 4 or 5 of their symptoms. This is why testing every single day that you have symptoms is crucial. And if you are experiencing any symptoms at all, period, you must stay home to prevent spreading whatever virus you have. When households have these multi-layered approaches for mitigation implemented, it reduces the risks dramatically that they will bring COVID home and infect their pets with it. It's important for us to protect our pets as best as we can, especially since we know that they can get sick from COVID and that it is even possible they will get sick enough that they could die from it. We also don't know how a COVID infection will continue to impact their health in the future, as people who have had COVID infections are more likely to have heart issues and diabetes and cognitive dysfunction, among other things. It's reasonable that we could be seeing those same issues in our pets over time. Until we have more research on this, our best bet is to be as careful as possible to minimize the risks that we could be impacting our pets this way. If the worst does happen and you do start to have symptoms, then it's important that you reduce your exposure to your pets for the duration of the time that you are sick and shedding virus. Now, this in people lasts at least 5 days, but some people are reporting that they will continue to test positive 2 weeks or sometimes even longer. So you need to keep testing yourself every day that you have symptoms and then continue testing until you test negative for COVID. Once that occurs, then you are less likely to be shedding virus and you can start spending time around your pets again. I do put up a new video most Fridays, and if you have a topic suggestion that you would like to see me cover in the future, please comment it down below. I do also try to highlight a comment from one of you each week. Here's the one from this past week. Thank you so very much. I do read every single comment and enjoy interacting with you in the comment section. Please share this video with everyone you know who has pets, and I hope that your weekend is a fantastic one. We will see you in the next one. Bye. I did consult some human medical, that sounds funny because of course they're people.